Good morning, everyone. We'll start today's briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. Joining us this morning is former Mayor Bill Purcell, member of the MDHA Board of Commissioners. Jim Harbison, Executive Director of the MDHA, Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell from the Metro Public Health Department are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Before we begin reviewing our COVID-19 metrics, I'd like to take a moment to commemorate the 6-month anniversary of the EF3 tornado that hit our community in the early morning hours of Tuesday, March 3rd. Today is the 6-month anniversary of the loss of Michael Delfini and Aubrey Sexton from the tornado. I want to revere the courage and compassion of neighbors helping neighbors as Nashvillians united to recover and rebuild in the aftermath of the storm. The 30 community partners in the long-term recovery group has been meeting regularly since March 3rd. The United Methodist Committee on Relief is one of our primary long-term case management partners, and the Tornado Recovery Connection phone line is still active. If you are a tornado survivor with an unmet need or know someone who needs assistance, please call 615-370-9255 at any time. That number again is 615-370-9255. Nashvillians have been through a lot over the past 6 months. Our city's resiliency is a testimony to the strength of every member in our community. I am grateful to everyone for the spirit of perseverance that all Nashvillians have demonstrated over these past 6 months. If I could give a medal for fortitude to many, many people in Nashville, I would. Now, as of this morning, Metro's reporting methodologies have changed to more closely match the state of Tennessee's methodologies. For those closely following, this has led to a noticeable change in several of our metrics, including our 7-day positivity rate and total number of tests performed. This change, which Dr. Jahangir will explain momentarily, simply aligns our reporting results. It does not affect how our city is responding to the virus, and we are still on the right path. But we must remain vigilant. Over the past week, we've had progress here in our fight against the coronavirus, even as the national death toll from COVID-19 has reached 180,000 and 6 million cases. This morning, Metro Public Health is reporting 73 daily new cases. Our 14-day moving average is now 121, with a total of 1,265 total active cases in Davidson County. This active case number is the lowest since May. Our 7-day average is 15.7 new cases per 100,000. Our immediate goal is 10 per 100,000, which is the state of Tennessee's own standard for quarantining facilities. Now, this number is now down from what was once over 60. Our transmission rate is 0.76. This is the lowest since the pandemic started. Nashville's 7-day positivity rate is 6.6%, well under 10%, which is our goal for this particular metric. These are our best numbers in months and are now well ahead of the state of Tennessee's averages. We've gone from being the biggest health challenge in the state to a model of effective response. Amended Orders 10 and 11 from the Metro Public Health Department took effect on Tuesday. This is to increase the opportunity for local business owners and their staff to safely return to work. Copies of these orders are available at covid19.nashville.gov, where businesses can also submit a question about any of Nashville's public health ordinances. Let me be clear, as our COVID-19 metrics improve, we will gradually adjust the dial of our economic reopening to help our residents return to normal as soon as possible and as safely as possible. But the threat of the virus is still very real. Everyone has a responsibility to maintain healthy habits. We have to protect both lives and jobs. Now, our number one problem is quitting on the job of social distancing. That's why we are increasing enforcement and awareness to prevent a relapse. We need to preserve this progress. If you feel symptomatic or suspect you have been exposed to the virus, do not hesitate to visit any of our 3 Metro Coronavirus Assessment Centers. Today or tomorrow from 7 a.m. to 1 p.m., all assessment centers and the Metro Assessment Hotline will be closed on Monday, September 7th, in observance of Labor Day. But if you get tested, you should have a result in 48 hours. Metro's Public Health Department and Public Health Enforcement Task Force are working very hard to keep both residents and visitors healthy throughout our community, and I want to thank them. Over the past weekend, MNPD officers issued over 5,200 verbal warnings and 16 citations for mask ordinance violations. Metro Police, the Beer Board, the Fire Marshal's Office, Metro Codes, Metro TLC has responded to suspected public health violations in downtown, Midtown, Opryland, and the Glencliff neighborhoods. They are responsible for much of our wonderful progress in the disease. Any resident in Davidson County can visit hub.nashville.gov to report a suspected violation of Metro's public health ordinances 24/7. Late last week, Metro's COVID-19 Financial Oversight Committee recommended $5 million in CARES Act funding to aid Nashville's music venues and small businesses, and I'm grateful to the Metro Council for approving this proposal on Tuesday evening. $2 million will be provided in grants to help local working musicians and other professionals in the performing arts, and $3 million will be made available to other small businesses. This funding will help our local artists, business owners, and workforce during these uncertain times. Now, this morning, I'm also pleased to announce that MDHA will be receiving an additional $8.4 million from the U.S. Department of Housing and Urban Development as part of the CARES Act, which is in addition to the $4.9 million received in an initial round of HUD funding. It is my pleasure to welcome Mayor Bill Purcell, who's a member of the MDHA Board of Commissioners and is here this morning to tell us how these federal dollars will go directly to assist more than 14,000 individuals and families in Davidson County who are experiencing homelessness or receiving housing assistance during this time of unprecedented challenge. As I've said before, federal financial assistance for cities or people during this public health crisis has not been adequate to the need. I'm grateful to the work of the COVID-19 Financial Oversight Committee in dispersing the available funds in an equitable and responsible way. The COVID-19 crisis and its social and economic upheaval has created enormous need in our community. There's a level of need that cannot be fully addressed by the amount of federal assistance that Nashville or any other city has received. And as our office works with the committee to consider other vital, timely allocations, we ask for more financial relief from our partners at the state and at the federal level. Nashville's own resources were stretched thin even before the pandemic. Now, only a few weeks remain for Nashvillians to self-report and be counted in the 2020 census. The more Nashvillians that get counted, the more federal funding we will receive for our hospitals, schools, road repairs, and other important public services. Your census response is protected by law and will never be shared with law enforcement or immigration agencies. To learn more and respond, visit 2020census.gov or call 844-330-2020. And remember, your response matters in shaping Nashville's future, so please go online and call today and get counted. I hope everyone has a safe Labor Day weekend, and whatever your plans may entail, please remember to wear a mask in public places, observe social distancing, and practice other healthy habits to keep yourself and others safe. And now I'll turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's some additional information on this virus in our county. This morning, the doubling rate of the virus is 150 days, meaning that it takes that many days for the confirmed cases to double. This has improved 33 days since our last update. This morning, 129 individuals are in Nashville hospitals with COVID-19. This is down from a peak of 222 patients in July. We now have 15% of floor beds and 13% of ICU beds available in our region. More positive news this morning. There are 1,265 active cases in the county. This is the lowest this number has been since May 31st, 96 days ago. In July, we had 5,800 active cases. As the mayor said, we have adjusted how the 7-day positive test rate is calculated in order to better align with how state and other local municipalities are calculating this exact metric. At the start of the pandemic, the state and other agencies, including Metro Public Health, calculated the percent positive by taking out repeat tests for individuals who had previously tested positive. The state recently changed this, and we decided to change as well so that it will be easier to compare our numbers with the state and our surrounding counties. Now, the total number of positive tests will be divided by the total number of tests administered, period. This change will allow us to get a better sense of how testing is going in our community. We've been running both formulas over this past week, and the updated formula, like the old formula, continues to show that the virus is slowing in our city and that the trends are in the same way, and this is what's most important. We said one of the reasons that we changed this was to allow us to compare our numbers with the state and surrounding counties using the same formula. This morning, our 7-day positive rate is at 6.6%. This is lower than the state and lower than all of our surrounding counties. Now, as we go into the holiday weekend, we must remain vigilant and continue to do what we have been doing to fight this virus. If you go out, please wear a mask. Don't gather in large groups and keep your distance from others. Now, as a reminder, we did see a spike after Memorial Day and after the 4th of July holiday. We have made significant progress over the past several weeks, so please, let's not lose the momentum that we have gained over this holiday. If we continue to fight this virus, the metrics will continue to improve and we'll continue to open up our city. So this Labor Day, please do your part to fight this virus. Now, also a reminder about Monday, which is the Labor Day holiday. The community assessment centers and information hotline will be closed on Monday, but they'll open up again on Tuesday. The assessment centers are open today until 1 p.m. and open tomorrow, also from 7 a.m. to 1 p.m. Kind of a neat fact is I suspect by the end of this week, we will have tested over 100,000 times in our community assessment centers. 100,000 times in 6 months. Free tests for our community. The information hotline is open also till 7 p.m. Today, tomorrow, and over the weekend. So if you have any concerns about the virus, or if you think you may have been in contact with someone who may have had the virus, please go get tested. Now, as we go into the Labor Day weekend, I'd also like to pause to recognize all of those essential workers who from day one of the pandemic back in March have been there for us. Healthcare workers, first responders, staff at our homeless shelters, our community assessment centers, the information hotline, all have been there from the beginning. Also, all those individuals working at grocery stores, pharmacies, restaurants, delivery drivers, and everyone else keeping essential businesses open and doing our day-to-day activities around the city, from trash pickup to electric and water. I know it's been very inconvenient and sometimes scary to be out in public working with COVID-19 so robust in our community at sometimes. I salute all of you, and you guys are all truly the heroes during these uncertain times. Thank you so much, and now I'd like to turn it over to Mayor Purcell. Thank you.
Well, thank you, Dr. Jahangir, and also to Mayor John Cooper for the privilege of being a part of this press conference today. I was last in this room in June and present for this press conference, and it is a great comfort to be here these weeks later to hear so much good news and so much progress that's been made in this city and to make this announcement. MDHA's mission is to create affordable housing opportunities, support neighborhoods, strengthen communities, and in the end, help build a greater Nashville. During this unprecedented time in our world, while many of our neighbors are struggling to make ends meet due to the COVID-19 pandemic, there is no greater moment for MDHA and Nashville to support and strengthen our neighborhoods. Thanks to the funding that we've received from the U.S. Department of Housing and Urban Development as authorized by the Coronavirus Aid, Relief, and Economic Security Act. That's the full name for what we know as the CARES Act. MDHA, in partnership with the mayor's office, will be able to provide assistance, help, to approximately 14,400 of our most vulnerable Nashvillians. These CARES Act funds are to be used to prevent, prepare for, and respond to the coronavirus, COVID-19 pandemic, by assisting individuals and families experiencing homelessness or receiving homeless assistance, and to support additional homeless assistance and homelessness prevention activities to mitigate the impacts of COVID-19. Through a request for applications process, MDHA staff has recently awarded, really just awarded, $4.9 million in community development block grant, coronavirus, emergency solutions grants, and coronavirus and housing opportunities for persons with AIDS coronavirus funds. Those are the buckets of funds that we've received here for this purpose. And all of them are used to move to provide assistance to more than 20 local nonprofit and social service agencies. The $4.9 million will support these nonprofits and agencies in supporting those more than 14,000 low to moderate income and vulnerable households, all impacted by COVID-19. And this will be done by administering emergency rent, mortgage assistance, and other housing assistance programs, providing services for homeless populations, and offering expanded support to persons with AIDS. To the more than 20 nonprofits who received this CARES Act funding, thank you for your commitment to support Nashvillians in need. And thanks to Mayor John Cooper for leading our city in a way which allowed us to receive and distribute these funds. The mayor makes the difference. I'm pleased to announce as well that MDHA will soon receive an additional $8.4 million in emergency solutions grants coronavirus funding, again from the U.S. Department of Housing and Urban Development, which will bring Nashville-Davidson County's total CARES Act funding to $13.3 million. After close consultation with the mayor's office, the continuum of care stakeholders, and officials from the U.S. Department of Housing and Urban Development, this second round of what's called ESG-CV funding will be awarded, again, to nonprofit and local government agencies to provide rapid rehousing for approximately 400 individuals and families all experiencing homelessness. On behalf of the MDHA board and staff, we thank the U.S. Department of Housing and Urban Development for awarding the City of Nashville these funds. Again, we'd also like to thank Mayor Cooper and his staff for their partnership, their leadership, as well as the important work of the continuum of care stakeholders for their input. So how can you help in this process now? MDHA is now accepting applications for this second round of CARES Act funding. Again, approximately $8.4 million. If you or someone you know works for a nonprofit or a local government agency, please reach out to them and make them aware of this opportunity to help our neighbors in need. Applicants may access the request for applications on MDHA's website. That website should be easily accessed through any of your search engines, but the actual site is www.nashville-mdha.org. www.nashville-mdha.org. All of the applications must be created and submitted electronically by September 18th. This is a very fast process. And the notion here is that these funds are needed now. This help is needed now. So we need your help now to make sure those applications are submitted. As you know so well, and the mayor makes clear from this podium and all across this city week after week, these are challenging times in our world and our city. But with your help and the help of many of our partners who have been working diligently these last few weeks and months, we believe that together we can set a foundation through these funds and all that they will do that will not only provide assistance to those approximately 14,400 Nashvillians impacted by COVID-19, but also have a considerable positive impact in our great city to build upon in all the months and years to come. Thank you, Mayor. Thank you, Nashville.
Thank you, Mayor Purcell. Before we begin our questions, just one clarification. The $2 million approved by Metro Council on Tuesday will go directly to independent music venues with an annual revenue of $5 million or less, which will undoubtedly have an impact on local musicians and other professionals in our music tourism industries. We'll start with Stacey Case at Fox 17.
Thank you. My question is for Dr. Jahanger. If you can explain to us this adjustment today, and now that we're gradually adjusting the dial for economic reopening, when do you think we will move on to phase 4? Also, other cities have adjusted their metrics along the way, realizing that some of the original metrics might not be attainable for a very, very long time to fully reopen, with more emphasis, for example, on medical capacity rather than active cases. Why has Nashville been slower to adjust, and was this the right approach?
Thank you. Dr. Jungir?
So I'm not fully sure I understand your statement why Nashville's been slow to adjust. I think we've been very transparent with how we're moving. We are moving slower. I would agree with Eric, because I think, and that's probably reflected in the fact that we have the lowest transmission rate we've had, I think since this whole thing started. We have the lowest amount of active cases since May. We are gradually turning that dial up of activities. I mean, in fact, for essentially most sectors, there's business activity now. We're changing that dial even further, so more and more things can happen. I would point out that just Tuesday, more things, including wedding venues and so forth, that opened up. So I don't know if necessarily, and I think from the very beginning we've said that we're looking at multiple metrics, right? So I'm not sure I fully understand the premise of the question, other than to say we've always shown the metrics. We've adjusted in a thoughtful process. When we've maybe have gone too fast and the metrics started going back, we dialed back, and now we're dialing back up again. And so I would happy to have the discussion further for all fun, but I think that I don't think, I would just push back and say I don't think we're just kind of being a little slow without any direction. So thank you.
Ian Jung at the Tennessean.
Good morning. Just quickly wanted to clarify, today's update showed 80,000 new tests done since yesterday's update. Is that due to the fact that we retroactively put in those repeat tests, or is that a typo? And my second question is, under what criteria will the city be evaluating written plans for residents and businesses to host events? I know last week when talking about this, we spoke about weddings, funerals, and similar types of events. Can you talk about the decision to kind of broaden up what type of events will be allowed? Thank you.
Thank you, Ian. We'll start with Dr. Jungir.
Ian, thank you for that question. You're right. If you look at the numbers of last week, it's like 220,000. I'm summarizing here, and today's closer to 300,000. That 80,000 discrepancy is exactly what you said. It is those repeat tests that previously were not put in our percent positive rate are put in there as in the full numbers. We have, and we'll make sure it's online, the percent positive rate tracked throughout through this entire epidemic. We'll have out, so you'll see the trends are comparable to where we were before. But yes, that's a one-time adjustment. Moving forward will be all included. But yes, that 80,000 difference is exactly what you mentioned. It's putting in those tests that were previously taken out because they were duplicate tests in an individual who already had a positive result.
Good morning. Anybody, any business that wants to submit a written plan for having any gathering over 25 can do so at the following email address, directorofhealth@nashville.gov. We already have a plan and experience in permitting a number of different events in the community based upon a few criteria. Number one, if it's outdoor rather than indoor, that's viewed as generally safer. So that's going to get more of a priority if it's outdoor. Number two, if face masks are required and to be worn and enforced at all times, that is also going to take a higher priority. Even if you are social distancing, if you're bringing people together. Number three, that social distancing is practiced and enforced. And number four, that there be no alcohol or very limited alcohol. These four criteria are what I call the fearsome four. Indoor, no face mask, no social distancing, and alcohol. So if we get to the opposite of that, they're going to be much more highly rated. So we very much look forward to trying to work with every specific venue, every specific community group that wants to do anything over 25 up to 125. And once we get a sense that they are really practicing well, then we'll work with them, event by event, but also facility by facility. Each one is taken on a case-by-case basis, and we're really looking forward to working specifically with all of you.
Brett Kelman at the Tennessean, you're on the air.
Hi, good morning, everyone. One more question about the nuance of the changes in test reporting today. It sounds like the vast majority of the 79,000 new tests reported today are old tests that are now being reported for the first time. Can you provide us with the number of truly new tests that would be reported today, so that reporters like myself, which are attempting to track this on our own, can keep our numbers up to date? Some amount of those 79,000 tests must be truly new, and it would be helpful to have that number.
Thanks, Brett. Dr. Jungier.
Sorry, Brett, I'm looking this number up as I understand your question, so I apologize for this delay. I apologize, Brett. Brett, let me get that back to you, but I'll make sure to get that answer to you very soon. Sorry, I'm just trying to do it on the run here. I'll get it for you.
Megan Mangrum at the Tennessean.
Sorry for the Tennessean kind of taking over this morning. In the same vein of how cities have adjusted metrics over time, I know that some of our original thresholds for reopening schools in phase 3, have any of those changed now? Is the city still using those metrics in terms of kind of recommending that schools reopen, or can you give us an update on what metrics are being looked at for that?
Thanks, Megan. Dr. Jungier.
So thank you for that question. I want to highlight where we have, in late spring, Mayor Cooper asked that we form a committee to reopen schools. And so Dr. Battle and I, as well as the head representatives from parochial, private, and charter schools all met, as well as with Opportunity Labs and pediatricians from Vanderbilt, as well as Meharry Medical College and Director Chief Swan. And we've put out a roadmap to reopen schools that set guidelines of how one should look into it. Okay, so that had transmission rate, it had case trends, and so forth. After our report went out, and once we roll back to modified phase 2, the task force, the mayor's office, allowed schools, each individual school or school district, to make their own decisions about whether to open or reopen, as long as it follows the guidelines that we set out in that plan to reopen Nashville schools. So I think each individual school's or school district's decision should be directed towards them of how they should open or not. But I would suspect that most school districts have a advisory team, and I would suspect that some of those metrics would include exactly what we talked about: transmission rate, cases per 100,000, case positivity in the community, perhaps in the city. And so that's kind of my answer to that. So it's not the task force or the mayor specifically directing each school system how to proceed. We hope that, obviously educators are, they're passionate about this and have a lot of expertise that they're leaning on. But so I would defer the specific questions per each school district. Thank you.
If I can just follow up on that a little bit, because I think it's important. Each school system in Nashville is determining its own decisions. Nobody is going to have any school system accept risks that those school systems and their parents and their children are not willing to accept and don't understand. I think MMPS is constantly in dialogue with its parents and teachers. So it is up to the individual systems to reopen. We can learn, and I think MMPS will learn from national examples about how to both do this effectively and when people do feel that they're not accepting too much risk. But it is my job a little bit to point out we are only at 15. We're only at 15. That is not, Labor Day is coming up. I'm worried about a spike around Labor Day that has set us back. These kind of long weekends have set us back repeatedly. Everybody has worked so hard to make progress on this. Let's not jeopardize it by pretending at this point that we're in a place where we're not quite there. Now, even at 10 per 100,000, there'll be a question for a whole lot of people. The 10 is not that you're safe. The 10 was the sign of unusual danger and risk in a community. And of course, you had to quarantine people in nursing homes. So being at 15 is still in the red zone. It's just at one point we were unthinkably at the red zone. So let's not take our eyes off of the challenge right in front of us. And really, I'm up here to say there's a Labor Day weekend. This is the time that all of us have to be especially diligent about masks. And if I were the parent of a child, as I am in Davidson County, and I see somebody not wearing a mask, I'm taking that personally, because that's directly affecting my child's ability to get back to normal, inevitably. Whether they're open or in a hybrid, the risk, the community-wide risk, has to be monitored and restrained. And that's what I want to ask all parents in Nashville, especially this weekend, and their own families and gatherings, to be vigilant on that. And then hopefully next week we can have a discussion about how perhaps we did not spike up, but we've able to preserve our progress.
Harriet Wallace at Fox 17.
Yes. Hi, good morning. Just a couple of questions. One, FEMA has announced that they will be discontinuing providing funding for masks, really more on the state and local level. With such an emphasis on masks and the need for them, this is for either Mayor or Dr. Jahanger, your thoughts about our capacity to continue to provide masks to our schools, to our essential businesses. Any concern moving ahead, or any plans, any areas where we're pivoting to accommodate for that loss in funding? My second question, I know that the decision about schools is up to the schools. It's not the mayor's call. However, the health department has made some recommendations. With regards to the athletic season in metro schools, the coaches have put together a more stringent, comprehensive safety plan for the athletes. Considering that, I would like to know, what is the position of the health department now with these new guidelines? Do you feel comfortable supporting reopening the fall athletic season? Thank you.
Mayor Cooper.
Thank you, Harriet and Fox 17. I'm going to talk a little bit about the second question first, if that's okay, on reopening schools. MMPS is on the path for games to resume. Somehow people, I don't think, are necessarily aware of that. Now, this is their own call. They're running the safety about their own students, but this, I think you'll look into it, will find that this is where there are. Now, strength and conditioning has to take place before there is a game. They are on the schedule of doing strength and conditioning, hopefully 4 games in late September. So this is delayed, but I believe MMPS and the coaches are on contact, particularly every Thursday, on reviewing where we are and how it is rolling out. Now, we have to learn from the experience of other places. There are going to be problems about people needing to be quarantined or conceivably games being forfeited in cases of disease levels. But I think everybody is very clear about this, that we are on path to go ahead with a delay. But while you are required to do strength and conditioning for so many weeks before you can even play, that is taking place right now. So the kids will be able to play. We need to have a community where that can safely happen. So that's why, again, if you're the parent of an athlete, high school athlete, you have a strong interest in making sure people wear masks, right? That's what needs to happen so that MMPS can roll this out safely. And now exceptional students will be starting in the school system right after Labor Day. It's going to be rolled out. After fall break, there is every hope that reopening will be a reality in Nashville, but we can all stop that if we stop doing social distancing, right? So again, if you're the parent of an athlete, boy, you have an interest in telling people to wear masks because that's how they're going to get back on the field safely.
The Department of Health in Nashville is committed to continuing to get masks and continue to give out masks. We partnered with the Parks Department. All of our community health center, the community centers in the parks, whenever they're open, masks are available there behind the desk. Walk in anytime, there will always be masks there. Once we run out of the masks the state has supplied us, the Nashville Public Health Department is going to be working with Metro to buy more masks. So we're going to always make this our commitment. We have a mandate to wear masks. We're going to buy as many as we need to continue to give out. And one of the ways we are giving them out is to partner with community organizations and groups, especially in our hot zones. If you're a community group and you want masks and you can help us give them out, give us a call. We're happy to partner with you. And Chief Swan was also going to talk a little bit about masks for schools.
Hey, good morning. So let me just concur what was just said earlier. One of the things that we did early in this process was make sure that all the orders that were needed or the schools felt like they needed was done through the Office of Emergency Management, through the state. And we know Governor Lee actually committed to make sure that all students and anyone in schools that needed masks would be given masks. So again, we feel very confident in this area. Again, we plan prior before anticipating this event that would be taking place right now with making sure every student and faculty, staff would have masks. Thank you.
Harriet, I believe you have one more question for Dr. Jahangir.
Yes. Could you please share your opinion about the proposed coronavirus vaccine? Your thoughts about it, your level of comfortability, and will we see this administered here in the Nashville area? Thank you.
Harry, thanks so much for that question. Coincidentally enough, on Monday, earlier this week, Dr. Caldwell, Dr. Gilwright met with Commissioner Piercy and her team to discuss this exact question. Because I think one thing that we're trying to do is always be prepared to take care of people here in Nashville. From what I gathered from a conversation, and I actually saw, I think some of it started being printed yesterday, the federal government, CDC, has stated that a vaccine will be available on November 1 to be given to the states. From what I understand, there's still a description of how that's all going to be distributed, but I suspect that the tier 1 group of people who are going to get that vaccine will be healthcare workers. So the state will probably work most likely directly with hospitals in our region to get that, and then individuals I don't know if I, as a active practice healthcare employee who operated on someone with COVID a few days ago, I'm going to be in that first line of group to get it. And then from there will be other tiers, right? Tier 2, Tier 3, and there'll be risk stratification of who gets it. I suspect Metro, as a municipality, a public health department, will probably be more involved in distributing vaccines in the Tier 2 and beyond phases. Your question about safety, so forth, the FDA and the CDC, and really the FDA in this thing, should not be politicized organizations. There's a great process that has been there that has resulted in millions of lives being saved because we've had a lot of great vaccines, a lot of great medicines. I hope that stays the way that it always has been, and if it stays that way and that very thorough process, I mean, there's several phase 3 clinical trials going on in our city right now, and I hope that those show great results as early as November 1 so that a phase 4 and beyond can happen. And if it is, then I'll be first in line to get a vaccine if I'm stratified in that risk group. But vaccines are critical for us to get over this virus. Everyone needs to get vaccinated, and it needs to happen when there's a vaccine that's been proven through the proper channels that have been established in our country. So yeah, I mean, it's a long answer to your question, but maybe as early as November 1, healthcare workers, and right now I have no reason to think it won't be an FDA verified process that is typical. So thank you.
Our last question today is from Blake Farmer, WPLN. Blake?
Yeah, I think a lot of us are trying to figure out what this change in how we track the numbers really means for Nashville. But I guess a big one is, would different decisions have been made had we been tracking all of the cases the way the state does over time?
Thanks, Blake.
In other words,
Blake, that's a superb question I've thought a lot about. Short answer is no. So when you look at the whole aggregate, and I'm going to just challenge our team here, we'll put out the graphs that compare how these numbers are pre and post these changes, right? And I've seen these graphs, and the trends for the most part are about the same. The number, so today is 6.6%. If you revert to the old way or that we did up until yesterday, I think it was like 8-point-something%. So really we're talking about a 2% discrepancy in the number, but the trends are about the same. And at the end of the day, no, because again, it's never been just about one metric. It just shows that, so no, the long answer to your question. But I'll make sure just that we get both those graphs that show both methods over the time frame, and hopefully I'll clarify it. And moving forward now, that number is going to be consistent with what you find both in our state sites, what you find on websites like covidact.now, covidnow.act.now, I can't speak anymore, or global epidemics, these national websites. This method that we're doing now is how all those national, well-trusted sources are doing it. And so you'll see there won't be much of a discrepancy, but we'll, I'm looking at the team here, we'll make sure to get you both graphs to show you the differences pre and post. So thank you.
The website is covidactnow.org. Those are all the questions we have this morning. I'd like to thank Mayor Bill Purcell for joining us today. As always, we're grateful to Amy Lankheit and our partners at Bridges for the Deaf and Hard of Hearing for providing ASL translation at these press briefings. 3,143 is the number of new tests, according to Dr. Jahangir. That's answering an earlier question. The next Metro COVID-19 press briefing will air on Thursday, September 10th at 9:30 a.m. Thank you for joining us, and have a safe Labor Day weekend. This concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.